welcome to another edition of Sound Health on Lagos Television. I am Olasumbo Mudupe. We bring you Sound Health every Tuesday at 6:30 p.m. and we try to enlighten the public on trending health issues from around the world. Today we are exploring the world of natural therapy. What exactly is natural therapy? We are having a certified expert therapist in the house to take us through the science, the scope, and all the facts and myths about natural therapy. Stay tuned. The conversation begins after this break. The program is still Sound Health on Lagos Television. Join us via Zoom this evening to share our expertise and explore the world of natural therapy. Is Dr. Sarah Babatunde. She is a specialist in physical therapy and natural therapy. Good evening, Dr. Babatunde, and thanks for joining us.
Good evening, ma'am.
To start with, let us know what exactly is natural therapy.
Okay, good day. I am so pleased to be here this evening. Physical therapy is one of the branches of natural medicine, which enables flexibility, posture corrector, and make you stabilize. What physical therapy is all about is just like a physiotherapy, but in natural medicine we call it physical therapy. Physical therapy is one of the best things we advise people to always go on a daily basis, because it's not only when people are sick that they need physical therapy. Physical therapy stabilizes the body, enables blood circulation, it corrects the posture.
All right, how does this therapy or this approach differs from conventional therapy or conventional medicine?
Okay, in um, uh, in natural medicine, we use natural therapies to support the body, to make the body to heal itself, to make the body have the ability to restore balance on both physical, mental, and on our lives and everything. That is why it is quite different from the conventional way. The conventional way is to diagnose, they treat primarily based on the disease, they use drugs, they use surgery. But in natural medicine, we did not believe in surgery except in emergency cases. We believe that the way God has made our body is for it to heal itself. And one of the best things to do is what when we prescribe our own natural medicine, it goes to each part. I mean, each of the organ that is being affected, awaken it, make sure that organ is able to do what it's supposed to do. That is why conventional and the natural medicine are quite different from each other. And that is why some people will say in natural medicine, their mode of treatment is quite slow, unlike the conventional. The conventional is a quick, fast action. But in natural medicine, it's not a quick, fast action. That is why we'll tell people you have to be patient with it if you really want to get out of that problem. Because it's a damage that has been made for years and you don't expect it to go immediately. So what natural medicine will do is to restore back the balance of that body. So it makes the body to heal itself.
All right, so in your years of experience, have you ever experienced situations where natural medicine fails, and have you also had to combine both?
Okay, yes. Sometimes we have to combine both. Like I said, in emergency, in a case that the surgery has to be done, you don't say you want to use natural medicine. But in cases that are not emergency, you can actually go for natural medicine. Like somebody who is having a bleeding, an internal bleeding. Now you can't say natural medicine will take care of internal bleeding. That is a conventional way. So you will refer them to the Orthodox hospital. So though we work together because we are all one. To me, we are one. Myself, I have some conventional doctors that work with me. If I have an emergency cases, I refer them down to the hospital. But if it is not emergency, if you are patient enough, you will get your healing in natural medicine approach.
We've heard from professionals that you cannot combine, it is not advisable to combine natural medicine with conventional medicine. How true is this? And does natural medicine interferes with conventional medicine?
That's a good question, ma'am. Yes, you can't combine natural medicine with conventional medicine. There's something we call chemical reaction and the body chemistry. If you want to use orthodox, you use orthodox. If you want to go for natural medicine, you go for natural medicine. But taking natural medicine at the same time taking conventional medicine is not advisable. So if you want to do orthodox, you do orthodox. If you want to do natural medicine, you do natural medicine. Go for natural medicine. Like I said earlier, if it is not emergency, natural medicine is the solution. But if it is emergency, orthodox is the solution.
How long does it typically take for you or a patient to start seeing healing or start experiencing healing? I know you mentioned that one needs to be really patient when you're taking natural medicine. How long does it typically take?
Okay. Like I said earlier, there's something we call body chemistry. As a professional, I don't give people 100% assurance that this thing will go in a bit of time because I am not good, number one. Number two, the damage in the body has been there for a while. Before you see a sickness that manifests, that's been in the body for a very long time before it manifests. And we're not talking of how long does it work. If I said you have to be patient with natural medicine, does not mean it has to be for years or it has to be for months, depending on your body chemistry. And also, it depends on what you are actually treating that patient for.
All right, what is the most common health concern that brings people to you?
Okay, most of the time, I like as a physical therapy, I have cases of stroke, I have cases of spondylosis, sciatica, lumbar. Most of the time, spine degenerative disease because of stiffness, muscle pull, and the like. So most of the time, we have a rehabilitation center. So they bring in those people, they bring in Down syndrome patients, children, and the autism because they need mobilization.
What is the biggest myth or misconceptions you like to clear about natural medicine?
Okay, that's a good question, now. People usually see natural medicine as far. And I am saying this confidently and as a professional in this field that natural medicine is one of the best and one of the things that should happen to everyone. When people come down, they said, I want to know if this will work. I want to know how fast are you in this field. I want to know if natural medicine actually works. Yes, it does work. But there's this misconception because of online vendors saying use this, when you combine this and this together, it's going to give you a magic. No, it doesn't work that way. Then I would like to clear this misconception of natural medicine practitioners are fake. We are not fake. We are not quack. We are being regulated because people will say they don't have regulation. They don't have their medication does not have dosage. That is not true. We have a body that regulates our practice, which is one of them is the Nigerian Council of Physicians of Natural Medicine in Nigeria, which I am one of them, one of the members and one of the executives there. So we have a body that regulates this thing. They go all around to check, to cross-check what our people are doing. So the misconception of people saying those people are quack, those people are not licensed, those people are not recognized is not true. We are licensed, we are recognized, and we are being regulated.
Are there any health conditions natural therapy must be avoided?
Yes. Yes, there are some health conditions natural medicine should avoid in cases of emergency. Most especially internal bleeding. Somebody who fell and they did an MRI on a CT scan and they say, oh, this person is having internal bleeding or there's something wrong internally. The best thing to do at that time is to refer them to the orthodox hospital, the conventional hospital. Let them take it from there.
All right, let's quickly talk certification. The perception is that most traditionalists or natural therapists do not have the adequate knowledge, let alone certification. They just, practice based on intuition. Is this the case? And what advice do you have for such people out there?
Okay, and for those that have not been certified, for those that have not gone to school to learn these things properly.
What advice do you have for patients who have told the parts of natural medicine but are yet to get healing?
Okay, my advice for them is to be patient and to adhere to strict instructions given to them. Because when you are coming down to natural medicine approach, you have to follow some instructions. Like I said earlier, our treatments are always based on holistic, which means we treat the body as a whole, not just pick one ailment and treat. We treat the body as a whole. And when you are treating the body as a whole, you have to adhere to some instructions, to some do's and don'ts of what you should do and what you should not do on a daily basis. So most of the time, our patients are always going against those things, which makes them not get the healing they have expected. So my advice for them is to be patient, adhere to strict instructions, work on your diet and your lifestyle. Because most of the time, the beginning of all those problems is from your lifestyle. And if those things are not adjusted, it's just as a result of you're not doing anything. So adjust your lifestyle, live a good life, eat good food, and do whatever your physician asks you to do.
Your final words as we wrap up now, Dr. Babatunde.
Okay. Yeah, my final word now is I would encourage people to live a good life because, like I said, most of the problem comes from our lifestyle, our food, what we ingest, what we wear, what we put on our body, most especially female. You know, there are some female, they are dark in complexion, but they want to get white things all of a sudden. Those things affect your body, it affects your internal organs because whatever that touches your skin goes into your internal organ, goes into your body. So my advice for everyone is make sure you live a good life. Eat a good food and visit your hospital regularly for checkup. Don't always wait until you are sick or until you are down. There's a saying that says prevention is always cheaper and better than cure. If you are waiting until you have been diagnosed of a disease, it might be the last time, or the disease might have grown to the last stage of disease. So always go for a regular checkup, go for massage therapies, go see your physical therapy for some things you're supposed to do. Like I said, physical therapy is not only for those that are sick, it is for everybody, for our stability, for our independence, and for our overall well-being.
All right, quickly, what are those other activity or session people that are not sick can access? Because you just mentioned that not just natural therapy isn't just for people that are sick. Can you quickly
Okay.
be brief on that?
Okay. Like I said, that physical therapy is not just for people that are sick. you go out every day, you make use of this body every day on a daily basis. So you should also take your time to take care of that body that work. Most especially those that always be on their skin. A banker, you're working in an office and you take your time to sit for more than an hour without a movement. There's tendency that person develop what we call spondylosis when that person retire or before that person retire. So such person or such people needs to visit a physical therapy for their massage therapy. Like I said, you are not until you are sick before you go for session. So most of the time we used to tell people go for massage therapy. Everything is not wrong. That sometimes you just need to do some massage therapy and enable blood circulation to your whole body. So that's the reason why I said not until you are sick before you see the physical therapy. You take care of you. Like I said, we do manipulation. We make sure the body is stabilized to be independent. So that's why you need to see a physical therapy. Let them see you, examine you, and know what to do at that time. Don't wait until you are sick. Physical therapy is for everybody, whether you are sick or not.
2 questions now. Is physical or natural therapy affordable, and what is the body doing, organization doing to ensure that it is also part of the health insurance scheme?
Okay, physical therapy is affordable, it's cheap, it's for everyone. A reason why it is cheap is for everybody to be able to afford it. And the organization is working on something for everyone so that they can use their HMO to assess that services. Yes.
All right, physical therapy is cheap and accessible. You are what you eat. You need to prevent sickness before it comes. You need to also see a therapist before you get sick. Dr. Sarah Babatunde, specialist in physical therapy and natural medicine. Thank you for dispelling myths and misconceptions about natural therapy.
You're welcome, ma'am.
Sound Health continues with trending health report from around the world. Please stay tuned. The program is still Sound Health on Lagos Television. I hope we've been able to demystify some myths and misconceptions about natural therapy, natural medicine. You are what you eat. What habits you imbibe today would actually tell on your health. Dr. Sarah Babatunde, I've been able to share some essential health insights about natural therapy. This is where we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 00358266603 or follow us on social media at Lagos Television, #Sound Health. A sound health is a sound mind. Make healthy living your choice.